When we think of musculoskeletal pain, we often think about tissue injury. However, it's important to realise that many of the chronic and recalcitrant problems we see in musculoskeletal medicine are contributed to strongly by poor metabolic health. As a sport and exercise physician, I see a huge range on the spectrum of patients in my clinic, from metabolic perfection with highly insulin sensitive and fuel efficient athletes to metabolically sick, diabetic patients with severely elevated blood glucose levels damaging their small and large blood vessels, and everything between. When we look at patients at the sickest end of the metabolic spectrum, we see a rampant increase in many of the chronic disorders related to this. And this includes tendon pain, such as Achilles pain, and this is increased by as much as 350%. Any and all other tendon problems like tennis elbow, jumper's knee, rotator cuff wear, and trigger finger also fall under this category. Osteoarthritis is increased by 150%, and it's not just driven by body weight and extra joint load. We see that high insulin levels independently are associated with osteoarthritis. Also, patients with hand arthritis have as much as a 40 to 50% improvement in their pain when they lose 5 to 10% of their body weight, which says it's not just about weight. Frozen shoulder or adhesive capsulitis, a 500% increase. And plantar fasciitis, more correctly termed plantar fasciosis, is increased by 165%. So it makes sense along the spectrum of disease, or what we call the metabolic syndrome, which is really just chronically high insulin levels and poor insulin sensitivity, and which, by the way, 30% of Australians have. Along this spectrum, there is an increased risk of these conditions. Now, why does this occur? Well, there are three main reasons that explain the strong links of poor metabolic health to tendon and joint pains. Firstly, we know that chronically high insulin levels lead to fat accumulation around the abdominal organs, and this so-called visceral fat is strongly pro-inflammatory as it releases chemicals called adipokines. At any moment, an aging human has wear and tear all over their body, but this just means those things are much more likely to cause inflammation and the pain that goes with that. We also know that spikes of glucose and chronically elevated glucose levels lead to glucose binding to our proteins and damaging them. This process is called glycation, and it produces advanced glycation end products. Now, this is pretty much the same process as browning or caramelization, but it's inside your tissues like your tendons, joints, and even the lens of your eye. Now, in the words of endocrinologist Dr. Lustig, you can roast your turkey for 200 degrees for 2 hours or at 37 degrees for 30 years. So here you can see this process being drawn out by the browning of rib cartilage playing out through the lifespan. Now, the same thing is shown here with increasing grades of osteoarthritis affecting the cartilage in our joints over time. Finally, the accumulation of fat in the liver, known as non-alcoholic fatty liver disease or NAFLD, can lead the liver to erratically produce enzymes called MMPs, and these degrade the tissue matrix such as in our cartilage and tendons. Now, while it's important to address the local sources for pain and optimise the loading conditions for recovery, undertaking lifestyle change is also of great value to many patients suffering these conditions as a manifestation of poor metabolic health before more significant health issues arise. There are different ways to achieve a low insulin lifestyle, and I recommend that patients and referrers take a look at my educational series outlining the theory and application of this intervention.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.